doctors from the Doctor's Verimi. Today in our health channel, we will be talking about hypertension or high blood pressure. Blood pressure refers to the pressure that is applied by blood on the arterial walls. So there are two types of blood pressure. Usually when we use a machine, there is two different readings. One is the top reading, which is called as the systolic blood pressure. The other one is the bottom reading, which is called as the diastolic blood pressure. The systolic blood pressure is the pressure exerted by the heart when it contracts, and the diastolic blood pressure is the pressure when the heart relaxes. So what is the high blood pressure definition? So as per the American College Guidelines, American Heart Association, they define the normal blood pressure to be anything below 120 by 80. So anything above 120 by 80, they have consistently being high is considered high blood pressure. So the top one should be below 120 and the bottom one should be below 80. Stage 1 high blood pressure is considered to be when the blood pressure systolic is 130 and the diastolic is between 80 and 89. Stage 2 blood pressure is considered to be when the systolic blood pressure is 140 and the diastolic is above 90. High blood pressure is a very common problem and often undiagnosed. The reason is because people will not have symptoms with high blood pressure. Often people will experience, if the blood pressure is very high, sometimes they might experience headaches, visual blurring, chest pain, shortness of breath, leg swelling and things like that. But they are not all the time. So it is often a good idea to check your blood pressure. We recommend people above the age of 40 check their blood pressure at least once a year. However, people with risk factors need to check their blood pressure more often. So what are the risk factors for high blood pressure? When people are getting older, increasing age or advancing age is a risk factor. Being overweight is obviously a risk factor. People in some ethnicities, they are at higher risk of developing high blood pressure as well. Consuming a lot of salt, drinking more alcohol than usually recommended, and also lack of physical exercise and smoking can cause high blood pressure. The other things that can cause blood pressure are if you are suffering from sleep apnea, where you are constantly snoring and it's affecting your breathing. Then also there are some underlying medical conditions that can cause blood pressure to be high, such as kidney problems, heart diseases, sometimes some of the hormonal dysfunctions, some structural causes in the arteries of the circulation, and also can cause high blood pressure. Untreated high blood pressure can lead to a variety of complications. The most common problem that we see in the elderly with untreated high blood pressure is called heart failure. Also, people risk themselves having stroke and heart attacks as well if there is poorly controlled blood pressure. The other problems that you can encounter with poorly controlled blood pressure is kidney problems, circulation problems in the feet, problems in the eyes and the vision. So it's very important to monitor your blood pressure. What are the things that you can do to maintain a normal blood pressure? So the first thing we normally recommend if people have stage 1 high blood pressure is that they manage their lifestyle. What are the things to manage? So the risk factors are obviously the thing that we go back to again. If you're smoking, stopping smoking is very good for blood pressure as well as all your health needs. The other thing is cutting down the alcohol, reducing the salt intake. If you are obese or overweight, bringing your weight down to a healthy range. In terms of the diet, introducing fruits and vegetables in your diet, and also introducing exercise in your diet. So the exercise we recommend usually is about 30 minutes of strenuous exercise at least 3 to 4 days a week. Now the doctor will usually discuss with you about blood pressure medications as well. So if you do have high blood pressure and it's consistently high, then medication is an option, and that can be discussed with your GP And often when you're on medicine, it's really important to take the medicine at the same time every day. And also make sure if you do develop any side effects with the medicines, to discuss those with your doctor as well. People who are on high blood pressure medicines need to get your blood pressure checked until it's very well controlled, even on a daily basis. And when it's very well controlled, you should be checking it with your GP at least every 2 to 3 months. So this is a quick update about high blood pressure and how it can affect your health. If you have any questions or comments, feel free to put them on the comment section. If you want to discuss anything else that is relevant to your health needs, put it in the comment section as well. We will be bringing in weekly videos, and if you are happy with these videos, you can comment them as well, and also subscribe to the channel. Thank you.